Auricular acupuncture, or ear acupuncture as it is also known, uses similar skills to traditional acupuncture, but with acupuncture stimulation limited to the external ear. Traditional acupuncture has been practiced for over 2,500 years, at least, and ear acupuncture is thought to have been around for the same length of time, albeit without the same notoriety. Auricular therapy has a long history of use in China. It was mentioned in the most famous of ancient Chinese medical textbooks, the Neijing. This ancient Chinese document was very specific about the needling of particular auricular points for the balancing of functional disorders related to a particular channel system. Auricular acupuncture owes a lot of its current popularity to the late Dr. Paul Noget, a French physician from Lyon. He is credited for research and development of auricular acupuncture since the 1950s and has even been nicknamed the father of modern auriculotherapy by the Chinese. He famously drew a chart of ear points that was mapped from the shape of an inverted fetus. This microsystem meant that by stimulating points on the ear, the whole body could be treated. Following on from this concept, we can look at various auricular points that will have some bearing on our aculift treatment. Many acupuncturists who I know and have worked with are not that familiar with the points of the ear, unless of course they are auricular specialists. These points are some of the most powerful, and many practitioners achieve fantastic results with their patients by only using these points. In fact, there are many successful acupuncturists who run only auricular clinics. There are several fine publications specializing in auricular acupuncture, and they all seem to feature very accurate diagrams showing the many points on the ear. Personally, I will always use the point Shenmen left and right for every aculift treatment that I perform. It is an effective point to use in combination with classical points like Yin Tang and Du 20 for relaxation and calming. Also, in conjunction with this, I will choose to use another auricular point that would correspond with a particular area of the face that I am keen to work on. For example, if I am interested in improving the area around the eyes, then I might consider auricular points that relate to this. Some of the points that I have found to be most successful alongside Shenmen are the points mandible, eyes, cheek, and mouth. However, you will be able to use the initial consultation to gauge which area to focus on for each particular patient. My advice for any auricular points would be to research them and see what points work for you and then incorporate them into your own treatment protocol. When needling auricular points, I like to use a 15 by 0.20 mm gauge 36 needle. I find it advisable to use a sterile swab to clean the ear prior to this. This area can be very vulnerable and must be scrupulously cleaned before you begin. Like its counterpart on the body, Shenmen is a powerful point for calming the spirit. It can also be used as an analgesic in combination with the 3 constitutional anesthetic points. It should be needled first before selecting a follow-up point. I tend to think of ear Shenmen, translated as spirit gate, as energetically equivalent to heart 7 Shenmen in the body. In Oriental medicine, the spirit is stored in the heart. Like heart 7, the earth point of the heart meridian, ear Shenmen has similar energetics in terms of grounding, balancing, and anchoring the spirit. Therefore, Shenmen quiets the heart, calms the spirit, and puts the patient into a state of receptivity for treatment. Because of these energetics, Shenmen should be the first point treated in the ear for almost every ear prescription, with exceptions explored later in the discussion of Shenmen. Noget calls Shenmen the God point. Shenmen enhances the vital forces of qi and blood. Mouth relates to mouth issues, for example, cold sores. The mouth point can be used to increase or decrease appetite. It is commonly used along with the hunger point in weight loss and stop smoking protocols to reduce both appetite and oral fixation. The mouth point is also referred to as the anti-fatigue point. Because the mouth point is located in a very tender area of the ear, stimulating the mouth point is invigorating. This factor accounts for the point's effectiveness in counteracting fatigue. Additionally, the mouth point stimulates appetite or the desire for food. The increase in fuel that comes from food consumption increases energy. This point can also be used to treat mouth problems such as ulcers, canker sores, and deviation of the mouth. The mouth point can also have an invigorating effect if a dispersion technique is applied. So, be aware that the mouth point is contraindicated when one is treating fatigue that accompanies insomnia, as excess stimulation can keep the patient awake. Forehead. This point is often used for headaches, but in this context can be employed for enhancing the forehead. This point is useful for treating local problems of the forehead such as wrinkles, acne, and pain and congestion of the sinuses and or forehead. It is used to treat yang ming, large intestine, stomach, headaches. Eye can be used for improving vision and brightening the eyes. In the ear, this is the primary point to treat problems of the eye such as decreased nighttime vision, eye strain, declining vision, myopia, presbyopia, eye twitching, and many other ophthalmological disorders. The eye point is especially effective when combined with other ear points such as brain, heart, liver, spleen. Shenmen, whose energetics also relate to the health of the eye. And occiput, since the visual cortex is located in the occipital region. In China, the eye point is used to treat teenage myopia with good success. As you can guess, temple is used specifically for headaches in this location. However, it can also be used to focus on this area of the face. This is a local point for treating problems of the temple, such as breakouts, tension, temporal headaches, one-sided headaches, and migraines. It is sometimes called the Taiyang point because the body acupuncture point Taiyang is located at the temple. This point, cheek, is also known as face and is used for cases of facial paralysis and working with the facial muscles. It is recommended for treatment involving this part of the face, so it would be a useful point to include, particularly for lifting the cheek. Mandible, also known as jaw, this can be selected to target jowls. This point can be used for problems with the jaw such as clicking, temporomandibular joint syndrome, and an aching or dislocated jaw. Neck. Again, relating directly to its name, this point can be used to relieve tension in the neck. This is a fast-working point for treating a host of neck problems, including stiff neck, torticollis, cervical disease, and misaligned vertebrae. Heart. This point has some correlation with Shenmen. This point can be used for all heart problems in both Oriental and Western diagnosis. Western diagnostic conditions would include tightness in the chest, palpitations, angina, circulation problems, hypertension, mitral valve prolapse, and stroke. Chinese diagnostic problems include all of these, as well as memory and concentration problems, emotional problems, anxiety, restlessness, and psychological disturbances, easy daytime sweat, and insomnia. Because the heart is the supreme controller in Oriental medicine and moves the qi and the blood, the heart point can also be used to control pain by moving stagnant qi and blood in the body. The heart point is also effective in treating eye problems because in Oriental medicine, the heart has an internal pathway or eye system that runs from the heart to the eye. As the lung governs the skin, either lung 1 or lung 2 can be used to improve the complexion. Anyone presenting with skin rashes, rosacea, or acne could benefit from this auricular point. Upper lung is essential in all respiratory problems such as shortness of breath, asthma, bronchitis, swollen glands, common cold, flu, and sore throat. From the Chinese perspective, lung is the master of the qi. Therefore, the upper lung is a primary point for increasing energy and moving the qi. This is the identical reason why it has been clinically found to be the major point in withdrawal symptoms because it improves and regulates systemic energy, thereby contributing to a feeling of well-being. Some sources say the upper lung point corresponds to the opposite lung or contralateral lung, and the lower lung point corresponds to the lung on the same side of the body as the ear, ipsilateral lung. For instance, when looking at the left ear of a patient, the upper lung point corresponds to the right lung, and the lower lung point corresponds to the left lung. We generally do not use them as pertaining to the right or the left sides, but more according to the upper and lower schema. However, this paradigm is an option. The lower lung point can be used similarly to the upper lung point to enhance lung function. It can be selected if the patient needs to breathe more deeply or if the patient's problem is in the lower part of the lung, such as a pneumonia. We use it this way, as well as when ear pathology is present on this point or to reinforce the action of the upper lung. Some sources suggest you may use the lower lung point in the ear to treat the lung on the same side of the body as the side of the ear being treated. That is, select the lower lung point in the left ear to treat the left lung and the lower lung point in the right ear to treat the right lung. And this is a possible framework to use when the patient clearly has a right or left-sided lung problem. Specifically, the ear at the lung point stimulates the vagus nerve, the longest cranial nerve, which innervates the lungs, diaphragm, stomach, and intestines. Sympathetic. This is a pain-relieving point, so it would combine nicely with Li4, PC4, and TH8. Sympathetic is another point like Shenmen used to treat multiple conditions. It is directly related to the regulation of the nervous system. It is sometimes referred to as the autonomic point. The autonomic nervous system is made up of sympathetic and parasympathetic branches. Joseph Helms writes that the auricle displays the only external manifestation of the vagus nerve and thereby allows access to the functions of the autonomic nervous system. The vagus nerve connects with the larynx, bronchi, heart, pancreas, liver, kidneys, and intestines. It exerts a direct influence on the regulation of stress. The sympathetic branch corresponds to stress, flight, and fright reactions. Thus, the sympathetic point, when tonified, stimulates the dilation of the blood vessels. Because of this ability, it is considered a primary point for pain, since certain types of pain such as fixed, stabbing, boring pain in Oriental medicine is considered caused by constriction or blood stagnation, which results in pain. The parasympathetic branch of the autonomic nervous system governs everyday organ functioning. When the sympathetic branch is dominant, the parasympathetic branch is suppressed. Stimulating the sympathetic point will assist in balancing both branches of the nervous system. Stimulation of this point causes the chi energy to irrigate the cerebral meninges so that the point can be used to treat shock, trauma, and any nervous system disorder. Subcortex. This point is known for its anti-inflammatory effects and can reduce swelling. Therefore, it will help the face to calm down during the treatment. It is also a point used for acupuncture analgesia, so it would work well with the anesthetic points and boost the effects. Brain, also known as the thalamus or subcortex, is involved in regulating the excitation and inhibition of the cerebral cortex. Diseases of the nervous, digestive, endocrine, and urogenital systems, as well as hemorrhage, insomnia, inflammation, pain, swelling, shock, prolapse, and excessive sweating can be treated with this point. Brain point is the second most important point in the ear, with Shenmen being first. We use it to augment almost every treatment because the brain controls every bodily activity. According to some sources, the brain point corresponds to the pituitary gland and the thalamus. Some sources call the brain point the subcortex. 0 point or diaphragm point. 0 point is thought to have a powerful influence in treating various conditions, including pain, sedation, addiction treatment, and inflammation. This point is also deemed to bring the whole body back into balance, and this homeostasis will be beneficial not only for how your patient looks, but for how they feel too. The diaphragm point is a powerful point that triggers movement of the diaphragm, thus assisting in deep breathing. According to traditional Oriental medical theory, the diaphragm is the place where the blood meets and then is directed to its proper pathways. Therefore, the diaphragm point is effective in the treatment of chi and blood stagnation. It is indicated for diseases caused by bleeding due to evil heat in the blood. When the diaphragm moves, liver chi is regulated and spread, and the distribution of chi and blood in the upper jaw is facilitated. The diaphragm point, or 0 point, also has an effect upon the emotions. by virtue of moving liver qi stagnation. Consequently, it treats depression, viewed as liver qi stagnation, and regularizes the emotions. This point then helps the upper jaw and the middle jaw communicate and dispels chest and mid-back tightness. Because it corresponds to the diaphragm, this point is good for treating nervous tension, hiccups, and pressure from the stomach or liver that follows surgery. It also treats jaundice. This point has mixed sympathetic, parasympathetic innervations. Kopej recommends needling it first in a treatment because it affects the reactive ability of the rest of the auricle. He says that it can make an unreactive ear reactive or a hypersensitive ear normal because it promotes homeostatic control. The diaphragm point also corresponds to the umbilical area, but some say this point does not correspond to the body's anatomy. However, the umbilicus is an area many do not think of. They have delineated its role based upon a functional observation of its effects. Some authors refer to this point as the master point. Relax muscle. An auricular point that literally does what its name suggests and relaxes the patient's muscles. This can be beneficial for patients who are struggling to unwind and really enjoy the treatment. This point, located within the liver area, is especially good for encouraging muscular relaxation. Pain comes from stagnation, and stagnation can lead to muscular tension. Therefore, relaxed muscle is an important point for relieving pain. Relaxed muscle is a central point in any pain treatment strategy for muscular pain, such as menstrual cramps or back pain. Relaxed muscle is also good for tension and relaxation in general. Like gallbladder 34 in the body, the influential point that dominates the muscles, relaxed muscle is an auricular point that treats muscular pain. Endocrine. This system in our bodies is responsible for the secretion of hormones into our bloodstream. So, where skin issues are caused by hormonal imbalances, this point can be used to help address this. Also, when the endocrine system is working efficiently, it will slow down the aging process and assist in retaining our vitality as we get older. Endocrine, also called the internal secretion point, is used to regulate all endocrine secretions. It is useful for hormonal problems. We discussed how the spleen sends fluid up to the lungs and they then disperse moisture in the skin. So this point can assist with hydration. Choosing the spleen point on the ear can also help to tone the flesh. This point can be used to treat any spleen syndrome in Oriental medicine, such as spleen qi and yang deficiency, or spleen qi deficiency with repletion of dampness, blood production, problems of the muscles, abdominal distension, and lethargy. The spleen point assists in the production of white blood cells, thereby enhancing immune function. The spleen point is an important point in the regulation of digestion, assuming the function of absorption of food that is assigned to the small intestine in Western medicine. This organ relates to the aging process, as the kidney governs all stages of development. If your patient has bluish eye bags, you may like to try this point, as the kidney is often linked to this problem. The kidney point can be utilized to treat a vast array of disorders that are considered kidney diseases in Oriental medicine. Such disorders include problems connected with bladder function, with the foundation, yin and yang, and growth, maturation, and development. That is, all life cycle disorders such as early puberty, early menopause, early hair graying, and more. The kidney point is an important point in respiratory disorders because in Oriental medicine, the kidneys grasp the qi of the lungs. This point treats immune disorders, builds blood, and regulates body warmth. It can be used for kidney stones, nephritis, lumbago, tinnitus, and other kidney problems. The liver is linked to the eyes, and we can use this point to directly improve this area and decrease dark circles. Liver is an important ear point used for all clinical energetics pertaining to the liver in Chinese medicine. The liver point is used to move qi stagnation and blood stagnation, build blood, and nourish yin. Treating the liver point benefits the eyes, tendons, muscles, ligaments, and nerves. It is a major point for facilitating digestion and for regulating hormonal and menstrual function. It treats stress, depression, migraines, hepatitis, spasm, convulsions, pain, and other symptoms that are a result of liver dysfunction.